to know if you have AIDS. Acquired immunodeficiency syndrome, or what is commonly known as AIDS, is one of the most life-threatening health risks today. Approximately 31.4 to 35.3 million AIDS patients die every year. Being able to detect the virus early may mean saving your life. When we say acquired, it simply means that this disease is developed because of a disease-causing agent, which is HIV in this case. Immunodeficiency means that the symptoms of the disease are characterized by the weakening of the immune system. Lastly, the word syndrome means that the totality of the disease process is caused and characterized by a group of symptoms. In this case, it is the development of different organ failure caused by the decrease of blood cells called CD4 and T cells. CD4 cells and T cells are very important cells as they are the greatest line of defense of your immune system, especially when it comes to HIV. The main problem with AIDS is that the HIV targets these cells to become a virus factory and spread the virus even more. That is the reason why AIDS can be a very dangerous disease. Here are some ways to check if someone is positive for AIDS. 1. Since HIV is the main and only cause of AIDS, the first thing that you have to do is have yourself screened for HIV. Some of the tests that are available are HIV antibody test, antigen test, P24 test, and fourth-generation test. 2. According to the Centers for Disease Control and Prevention, or CDC, a positive HIV patient can be identified as an AIDS patient if he or she has one or both of these. First is that the patient has or will develop at least one infection that is said to be opportunistic. The second is that the patient's CD4 cell count is 200 cells or less. The normal range for CD4 count should be between 600 to 1500 cells. 3. The World Health Organization, WHO, has declared 4 stages of the evolution of HIV to AIDS. The last stage is where the indicators of AIDS show up. Some of the said diseases are toxoplasmosis of the brain, a parasitic disease, candidiasis of the esophageal linings, trachea down to the lungs, and Kaposi sarcoma. 4. It is also better that you take note of some of the unexplained disease that an HIV-positive patient might have. Some diseases to watch out are recurrent upper respiratory tract infections, pulmonary tuberculosis, and chronic diarrhea. AIDS can be prevented, but never can be cured. Prevention, like having protected sex, is still the most effective way to get HIV and AIDS out of the way. Ignorance excuses no one, so you must learn how to take care of your body and should be aware of the things that may harm it.
AIDS stands for Acquired Immune Deficiency Syndrome.
Air kills the virus.
AIDS affects 8,200 people per day.
AIDS affects the immune system.
AIDS is produced from sexual contact.
AIDS can be transmitted by breast milk.
Every hour, 2 Americans between the age of 13 and 24 are infected with HIV.
Not today.
Mother and child transmissions are completely avoidable.
34 million people live with AIDS today worldwide.
But first, breaking news. Overnight, 200,000 people contracted HIV/AIDS, and doctors have made advances in HIV immunity. Interviewing 2 of the people who helped make the advances is Microphone.
Microphone here with 2 of the people who helped discover these new weapons against AIDS. Dr. Aladdin and Mr. Mike Keister. How are you guys today?
Good. I'm good, and you?
I'm good, thank you. So, Dr. Aladdin, what kind of things did you discover?
We made basic research advances, such as finding that natural polypeptide molecules called chemokines can suppress HIV, offered new weapons against the virus, and raised the possibility that HIV infection may one day become a chronic rather than fatal disease.
Interesting. This next question is for you, Assistant. Hello, Mr. Mike Keister. How did you make these discoveries?
We discovered HIV-1 protease, which is a retroviral
protease that is essential for all life cycle of HIV. The retrovirus that causes AIDS, it makes new proteins that are able to make infectious HIV cells. Without these proteins, the disease is no longer infectious.
Thank you, doctors. It was great to talk to you guys today.
You're welcome.
Thanks for talking to you.
And we'll be right back after this message from our sponsors.
AIDS away! Hi, Alan Hammond here. Are you tired of these pesky AIDS killing you and what have you? Well, no longer. We now have AIDS away. Here, let me show you how it works. Little A for AIDS. Chew. Swallow. My AIDS are gone!
My name is Microphone, and I'm the founder and CEO of AIDS Away, and I'm here to tell you a little bit about what our drug is all about. Researchers are continuing to develop many new types of AIDS and HIV medications, but for today, HIV-positive people have many options for what they can do to help with the effects of HIV/AIDS. These options include anti-HIV medications that treat HIV infections, drugs that treat the side effects of the disease or HIV treatment, or even drugs that treat infections that result from a weakened immune system. But I'm here to tell you that AIDS Away helps with all of these. The FDA has approved more than 25 antiretroviral drugs to treat HIV infections, but the FDA also says that the most successful drug is AIDS Away. This is because AIDS Away helps lower the viral load, fight infections, and helps improve your quality of life. The goals we have reached are to control the growth of the virus, improve overall immune system function and status, to suppress symptoms, and to produce as few side effects as possible. Thank you and have a nice day.
Earlier today, Microphone caught up with a local resident who contracted the disease. Also, no need to worry about that house that caught on fire. A flash rainstorm came and put out the fire at the house.
Microphone here at a local park, and I have a local black man over here who has believed to have contracted the AIDS.
Hold on a second. Hey, come here.
Oh, yeah. It's okay.
Tell me I'm not going to the league.
What's your name, sir?
Robin Banks?
So I hear you contracted the disease.
Yeah. Don't tell my mama.
Diarrhea, vomiting, tingling of the hands
Oh.
and feet.
Oh, yeah. Oh, tell me about
Have
it.
you been experiencing any of these side effects?
Well, when I shoot the ball, right? Oh, it was so bad. Okay, that was not me, cause my hands be tingling, right? And my feet, I don't even know.
Doctors have invented new weapons against AIDS. Are you aware of these?
No, I am not. But check this out. It's the only weapon I know right here.
Wow! Bubba, you're cute.
Well, that's going to do it for my report here. Microphone here.